Hey everybody, this is Dr. Choi here from North Texas Dental Surgery Wisdom Teeth and Implant Center. I wanted to make a video talking about a common question. People come into the office and during the consultation or before surgery and they ask me, hey, is wisdom teeth removal painful? Well, we can address that kind of in multiple phases, and we talk about number one, is it a painful surgery, number one, and number two, what's my recovery going to be like? Is that going to be painful? So let's talk about during the actual procedure. Number one, my first recommendation is if you want to avoid having a painful surgery, you want to go to somebody that does this all the time, right? So if you go see a surgical specialist, get your wisdom teeth removed, and this is kind of something that they're doing all day, every day, then what that probably means is they have more experience. They're going to be able to go in, take out your wisdom teeth, and just get out, okay? The sooner that they do this, the less time that you're actually in the procedure, less time you're involved with this, then chances are, because it's a quick in and out surgery, your body's just going to heal better. Over the years, I've heard horror stories from patients where people were talking about getting their wisdom teeth removed over the span of 1 hour, 2 hours, 3 hours. Always hearing the stereotypical story is like, hey, I think the surgeon had like his knee in my chest and he was like yanking all this time and it was a brutally painful experience. In my 10 years of practice, I've just heard stories like this over and over and over again. So again, my number one recommendation is go see a surgical specialist who does this all the time. That makes a significant difference because the time, length of surgery, all that stuff is going to be vastly improved. Now let's continue talking about your surgical experience. So surgical experience, I'd say if you want the most pleasant experience and you don't want a painful experience, make sure you get IV sedation. And what we're talking about is they're going to start an IV in you, they're going to give you drugs, you're not going to remember anything. Okay, you want to go to sleep, you don't want to remember anything. That's the best way to have your procedure. Now, there's also another option. It's called oral sedation. So versus IV sedation, where they're actually getting the fluids and the drugs within your veins, the actual oral sedation is popping pills that kind of give you that effect to help you relax and try to forget some things. Now, here's the one catch about that. The one thing about oral sedation that you got to understand is that it takes a while for the drugs to kick in, typically about 45 minutes to an hour, and everybody responds differently. Some people react great and they take 2 pills and they don't remember anything. Some other people, you can give them 2 pills and they remember everything. So in regards to like the whole point of the oral sedation or the sedation is that you want to go to sleep, you don't want to remember anything, but the problem is that the oral sedation might just help you relax, but you might remember the whole experience. So again, if it comes to pain, because if your wisdom teeth removal is going to be a very difficult one, you might remember some of the things, and overall, is that going to be a less painful or a memorable procedure, right? So oral sedation versus IV sedation is something that you really want to watch out. So try to always get IV sedation. And then another option too is that doctors can offer you nitrous. Keep in mind, nitrous can also help you relax. It works great in some patients. It works terribly in some patients. Sometimes we have the nitrous, cranking at the maximum allowable amount. But the thing is that a lot of patients, will still feel like they don't feel anything, right? It's just like I don't even know what this nitrous is doing for me. That's not for a lot of all the patients, but there are some patients that occasionally say, hey, when you give me the gas, some people feel like they've had several drinks and they feel fantastic. Other people will say, I don't feel anything. So again, nitrous can kind of be like oral sedation where it's very unpredictable. Okay, so that's in regards to the actual procedure. Now let's talk about after the fact. How much pain are you going to experience after the fact? So number one question would be, how impacted are your wisdom teeth? So everybody's wisdom teeth are different. If your wisdom teeth are very, very impacted, that can mean more bone removal, that can mean more cutting up of the tooth. So bottom line is that the more impacted your wisdom teeth are, the harder your recovery is going to be, and therefore the more pain you're going to experience after the procedure. Number two, how old are you at the time of the wisdom teeth removal? So if you're a teenager, you're going to heal a heck of a lot better than you would in your late 20s, 30s, 40s, etc. The older we get when we remove our wisdom teeth, just the harder it is going to be, and therefore the longer recovery. So therefore the more pain you're going to experience. Question number 3, do you smoke? Bottom line is, if you're a smoker, the bottom line is that you're just going to heal more poorly. And that exposes you to something which is called dry socket. And dry socket is definitely more common in patients that smoke. And dry socket, if you're talking about pain post-operatively, is extremely painful. Dry socket is something that you don't want to get. I try to put the fear of God in my patients when I'm talking to them about their post-op instructions. Do everything you can to avoid dry socket. Therefore, make sure you do not smoke. Okay, number 4, did you have any surgical complications? This goes back into what I was talking about earlier. You want to make sure that you see a surgical specialist that does this all the time. You want to make sure that he goes in and out takes care of your procedure as fast as possible. You don't want to be one of those horror stories that we hear of every once in a while where someone was in their mouth doing a procedure for an hour, 2 hours, and where they remember everything. Because again, over my career, I've heard that story way too many times. And point number 5, did you follow your wisdom teeth removal post-op instructions? Okay, so we're gonna give you a list of instructions. It is imperative that you make sure that you follow all the instructions very carefully. Do not just blow them off, because if you experience something like dry socket or infection, it's just gonna make your recovery worse and therefore a more painful recovery. All right guys, I really hope that was helpful for you guys. So good luck with your wisdom teeth extractions. Thanks.